Good morning. Today's lecture is about protein synthesis inhibitors. Protein synthesis inhibitors include tetracyclines, aminoglycosides, macrolides, clindamycin and lincomycin, chloramphenicol, and fusidic acid. To start with, tetracycline is highly effective against rickettsia, gram-positive and negative bacteria, and chlamydia. It inhibits protein synthesis by reversibly binding to 30S subunit of bacterial ribosome and thus preventing binding of amino acyl tRNA to mRNA ribosomal complex and thus inhibits protein synthesis. As you know from your previous study, the ribosome is the site for protein synthesis and thus these antibiotics they prevent protein synthesis for the bacteria. The resistance for tetracycline is wide and highly prevalent, and thus the clinical uses for this antibiotic are limited. Tetracycline resistant strains are usually susceptible to minocycline, which is again another kind of or let's say it is very closely related to tetracycline. The absorption from the GIT is incomplete. Tetracycline is about 60 to 80%, while doxycycline 95%, minocycline is 100%. Diary foods decrease absorption by forming non-absorbable chelates with calcium ions, also magnesium, iron, and aluminum that comes in antacids. If you have studied antacid before, you may know that aluminum is an important ingredient in antacids. فلذلك ينصح للمريض اللي ياخذ تتراسايكلين انه to avoid antacids بالاضافه الى انه to avoid dairy products يعني مثلا شرب الحليب او الاجبان. Tetracyclines inhibit vitamin K producing intestinal flora, thus can potentiate anticoagulant effect of warfarin. بعد شنو other interactions? Digoxin increases toxicity, increased toxicity with tetracycline, and oral contraceptives, the effect of them decrease with the use of tetracycline. Distribution, as we said before, it is chelating with many elements, so it binds in tissues that are undergoing calcification, as in teeth and bones. As you can see in this picture, it causes discoloration of teeth. They can cross placenta and so affect fetal bone growth with brown discoloration of teeth. And they are widely distributed in body except CSF. And minocycline is the best CSF penetration as compared with tetracycline or doxycycline. Regarding metabolism and excretion, they concentrate in liver and partially metabolized and secreted into bile and urine. Doxycycline and minocycline are largely excreted in bile and thus used in renal failure. فإذا واحد سألك يعني patient, you have a patient with renal failure and you should choose a drug that can be metabolized in the liver, doxycycline is a good choice. Given orally or IM, tetracycline can be given IM. There are many topical preparations in form of cream, ointment, eye drops. General therapeutic uses. هذا المرض اسمه Lyme disease. It is caused by a kind of bacteria or kind of bacteria called spirochetes. Specifically, it is Borrelia burgdorferi from the tick bite. يجي من بعض الحشرات من يسموها العفة إن صح التعبير. It leads to skin lesions and headache, fever and arthritis. بعد ممكن يسوي mycoplasma pneumonia. Used in treatment of mycoplasma pneumonia. Tetracyclines are used in treatment of mycoplasma pneumonia and can be also used in treatment of acne. حب الشباب. Also can be used in treatment of chlamydia. الchlamydia يعني it's responsible for many diseases. واحدة منها الليمفوغرانيلوما فينيريوم kind of sexual transmitted disease اللي يؤدي إلى lymph node hypertrophy and obstruction. Lymph node enlargement, especially in the inguinal area. Chlamydia trachomatis, it affects the eye. تراخوما، مرض التراخوما إذا سامعين به. It's caused by chlamydia. بعد سيتاكوسس أو اللي هو في المرض يؤدي إلى نمونيا، hepatitis, myocarditis and coma. بعد UTI chlamydia that is causing UTI يعني it's very common nowadays, especially in men. And the drug of choice here is the tetracycline or doxycycline. بعد أكو other disease that can be treated by tetracycline. Cholera, vibriosis, أحيانا يسمى vibriosis. يمكن هذا فد استخدام نادر للتتراسايكلين for intestinal pathogens or for treatment of bacterial diarrhea. In the treatment of bacterial diarrhea يستعمل for cholera. بعد يستعمل for H. pylori that is causing an ulcer. And in treatment of syphilis. طبعا واحد من المحاضرة السابقة قلنا انه السيفليس drug of choice بالنسبة للبنسلين، لكن إذا كان هو patient sensitive allergic to penicillin طبعا هذا نفكر بالother choices اللي هي تكون من المحتمل يكون دوكسايكلين أو تتراسايكلين. بعد عندنا الليبتوسبيروسيس. هذا disease that's caused by bacteria called leptospira. Leads to headache, muscle pains and fevers. Could be severe or high fever with bleeding from the lungs due to transmitted infection from rats. ينقل هذا المرض من الراتس. Some protozoa like amoeba or malaria are sensitive to tetracycline, so it can be regarded as a drug of choice. Anaerobes, الانثراكس، الجمرة الخبيثة أيضا sensitive to التتراسايكلين، ممكن يعالج التتراسايكلين. Selective uses الديميكلوسايكلين هو أحد مشتقات التتراسايكلين. Inhibits the renal action of ADH, antidiuretic hormone, and thus can be used in treatment of ADH secreting tumor. What are the adverse effects of tetracyclines? يعني هو commonly causes it causes GI discomfort, anorexia, gastric pain, nausea, vomiting, and diarrhea. Teeth discoloration, as we said before, impaired bone growth, the incorporation into the bone, it binds with calcium. Photosensitization, it causes photosensitization، نوع من التحسس لأشعة الشمس، فاللي ياخذون تتراسايكلين ممكن يحصل عندهم severe sunburn in the sunlight، كما يحصل مع الدوكسايكلين والديميكلوسايكلين. وبعد شيء يصير عندهم photosensitization as you can see here in this picture. وبعد أيضا ممكن يحصل nephrotoxicity contraindicated in pregnancy, lactation, children under 8 years, as we said before. إنه ليش؟ إنه يسوي incorporation into the bone، وهذول بعدهم they are growing and it leads to teeth discoloration. Renal insufficiency, as we said before, we can use doxycycline in renal insufficiency. Now we come to the next topic, which is aminoglycosides. It binds to the 30S ribosomal subunit بتاع streptomycin or 50S subunit بالنسبة للجنتاميسين and others. طبعا هنا من نتكلم على ال 30S or 50S ribosomal subunit, we mean bacterial ribosome. يعني هو الرايبوزوم ترى هو موجود بالبروكاريوتس وبالإيوكاريوتس، لكن هذين الدراجز they are working on prokaryotic ribosomes، فما يأثرن على اليوكاريوتس، على البروتين synthesis in human cells. النتيجة when it binds to the 30S or 50S ribosomal subunit of the bacteria, it affects protein synthesis and thus inhibits bacterial growth. فشنو choices or for aminoglycosides here? It's used for aerobic gram-negative bacteria and staphylococci. So when you hear about gram-negative bacteria are common cause for intestinal infections. Then administration, they are poorly absorbed when given orally. All are given parenteral، يعني دائما على شكل حقن. Injection، ماكو tablet or capsule of aminoglycoside except neomycin. neomycin ممكن نشوفه in the form of many topical preparations for topical infections like in ointments or creams or eye drops، ولا البقية هنا كلهن are injectables. Well, aminoglycosides, as we said, they are for injection and thus they cause systemic effect, and this includes streptomycin, gentamicin, amikacin, tobramycin and netilmycin. بينما topical aminoglycoside هو neomycin. There are some specific criteria for these drugs اللي هي إنه tobramycin slightly more effective against Pseudomonas. Amikacin and netilmycin are useful against gentamicin resistant bacteria. هو الجنتاميسين هو كان الفيرست جنريشن، أول دراج ظهر بالنسبة للأمانوجلايكوسايدز، بعدين بدأت تظهر على الدراجز الأميكاسين والنتلماسين اللي يعتبر newer agents and thus can be used for resistant bacteria to gentamicin. Neomycin is very toxic. لذلك it's only limited to topical use only. Regarding pharmacokinetics, they have good body fluid penetration except CSF and respiratory secretions. لذلك لاحظوا هاي المسألة إنه if you have a patient with pneumonia, don't consider aminoglycosides as a drug of choice. It's a very poor drug in respiratory infections. They accumulate in inner ear lymph and to affect the hearing all across the placenta. They are rapidly excreted in urine and thus adjust the dose in renal impairment. The uses of aminoglycosides. بالنسبة للstreptomycin can be given IM or IV, can be given for bacterial endocarditis, gram positive Streptococcus viridans. Sorry, bacterial endocarditis with penicillin اللي هو caused by Streptococcus viridans and can be given also in tuberculosis. Gentamicin or amikacin can be given IM or IV in combination with penicillin or cephalosporin in septicemia, urinary tract infections, as for E. coli or Enterobacter or Klebsiella or Proteus, and in meningitis. أما topical application as drops or for the eye, ear, or nose, cream could be used for wounds or skin infections, especially for staphylococcus. الادverse effects أهم adverse effects هي الأوتوتوكسيستي والنفروتوكسيستي اللي هي very common. الأوتوتوكسيستي يؤدي إلى deafness or vertigo لأنه هو يروح على ال inner ear. It affects the sensory cells in the inner ear اللي مسؤولة عن السمع والتوازن. فلذلك يؤدي إلى deafness and vertigo. لذلك فيما يخص الأمينوغليكوسايدز يعني you should be very careful when you prescribe aminoglycoside. يعني تكون حذر ومن تحسب الجرعة تحسبها بدقة ليكون تتجاوز الليمت المقرر إلها وإلا يعني سيؤدي ذلك إلى حصول adverse effects والadverse effects مالته من النوع السيء جدا وتكون يعني غير قابلة للشفاء. خاصة إنه الأوتوتوكسيتي ممكن تحصل with high levels for long duration. بعد ممكن يؤدي إلى نفروتوكسيستي. Other side effects ممكن يؤدي إلى neuromuscular paralysis. As aminoglycosides reduce acetylcholine release from the motor nerve endings and thus cause paralysis and fatal respiratory arrest. Apnea on IV injection. apnea يعني توقف التنفس. The blockade if severe is treated by calcium gluconate. هذا الانتيدوت يعني المضاد للتأثير الأمينوغليكوسايد for neuromuscular paralysis. How can you treat this side effect? By giving calcium gluconate. لذلك من تعطي الانجكشن مال الأمينوغليكوسايدز to avoid such side effect as neuromuscular paralysis, either you give it IM or you give it slow IV over 3 minutes. Don't give it as a rapid injection. Other side effects, contact dermatitis خاصة مع النيومايسين topical application. نيجي now to the macrolides اللي تشمل الاريثرومايسين، الازيثرومايسين. الاريثرومايسين اللي هو يشتغل أكثر شيء على strep والstaph والtelithromycin. Mechanism of action, again, it binds to the 50S subunit of bacterial ribosome, inhibiting translocation step of protein synthesis, and it could be bacteriostatic or bactericidal, depending on the dose. It has better intracellular concentration with gram-positive bacteria. Clarithromycin and zithromycin are more active on anaerobes. It is given orally. Well, absorption is good. Intravenously may cause thrombophlebitis. Intramuscular is painful. أنا بالحقيقة ما شايف يعني injection of erythromycin or clarithromycin هو الماشي إنه يستعمل orally. Distribution, it has good distribution in the body fluids except CSF, crosses the placenta well and diffuses into prostatic fluids, concentrated in liver. Azithromycin has very long half-life of 3 days. نجي على هاي النقطة مع diffuse into prostatic fluids. هذه المسألة يعني من المسائل اللي ممكن تؤدي إلى recurrent or chronic UTI in men. يعني يصير أكو prostatitis. يعني هو جزء من urine tract in men هو البروستات. if it is affected by UTI يكون علاجها صعب لأنه قليل من الانتيبيوتكس can cross and diffuse into the prostate. واحدة منها هي الماكرولايز. وأيضا هسه ذكرنا بالموضوع السابق التثراسايكلينز أيضا they have good prostatic penetration. Drug interactions are uncommon with azithromycin because this agent does not inhibit hepatic cytochrome P450. Clarithromycin increases plasma concentration of the digoxin and inhibit hepatic metabolism of drugs. Drugs there is inhibited metabolism with macrolides, ethylene, warfarin, carbamazepine, cyclosporin, methylprednisolone, and terfenadine. So try to avoid use them in liver disease patients. We are excreted, concentrated and excreted in active form in the bile. Clarithromycin excreted in urine and bile. What are the uses of macrolides? They are used in upper respiratory tract infections as the mycoplasma pneumonia, streptococcus pneumonia, legionellosis pneumonia, Corynebacterium diphthery. يعني بشكل عام لما يخص respiratory infections, macrolides are one of the best choice drugs. Acne, حب الشباب, as we said before, syphilis, kind of sexual transmitted disease or STD, and chlamydia. It is an alternative to penicillin in allergic patients. هو السبكترم مال الماكرولايز كلش شبيه وقريب من البنسلينز يعني نسبيا السايد افكتس مالتها يعني قليله. فهو first choice when you have a patient who is allergic to penicillin, first choice that comes into your mind is macrolides. Clarithromycin can be used as anti-H. pylori for peptic ulcer. Also, it is effective in staphylococcus infections. What are the adverse effects of macrolides? They cause gastric distress, nausea, vomiting, pain, and diarrhea, especially with erythromycin, the main cause of drug withdrawal. الحقيقة erythromycin it may cause severe diarrhea. بحيث بعض الناس ما يتحملها. يعني diarrhea مع erythromycin is horrible. It may lead to drug withdrawal. المريض يترك العلاج. Cholestatic jaundice. When erythromycin estolate form is used ممكن يؤدي إلى الإصفار. Ototoxicity in high doses. Now we come to the clindamycin and lincomycin. Again, these bind to the 50S subunit of bacterial ribosomes to inhibit protein synthesis. They are bacteriostatic, and clindamycin is usually more active than lincomycin, in particular in cases caused by anaerobic species. The antibacterial spectrum is similar to erythromycin, and they have increased activity against gram-positive, negative, and anaerobes and Staphylococcus aureus. Regarding Bacteroides fragilis that causes intestinal sepsis, again it is active but not effective for Clostridium difficile اللي هي ممكن نسوي لنا pseudomonas colitis. It is not effective for this bacteria. They are well absorbed orally, IV or IM, and they are well distributed in antibody fluids, but not CSF. They have good bone penetration, and this is important. أيضا البونز يعني هم قليل من الانتيبيوتكس they can cross or penetrate the bone well. They are excreted into bile and urine. Therapeutic uses بالنسبة للكلينداميسين lincomycin purulent osteitis caused by anaerobes. Osteitis هي نوع من inflammation of the bone يحصل من يصير invasion of the bone by bacteria by usually anaerobes, and هذه ايش وقت تحصل؟ هاي تحصل مثلا حوادث السيارات او كسر يحصل فيصير contamination of the bone. هنا طبعا يكون يعني it is hard to treat and deal with, so you should think of lincomycin or clindamycin. Sepsis caused by bacteroids or other anaerobes. Prophylaxis of endocarditis. Toxoplasmosis. Toxoplasmosis بالحقيقة هو مو بكتيريا، هو نوع من الباراسايت caused by Toxoplasma gondii. Pneumocystis carinii in AIDS patients. هذه نوع من البكتيريا اللي هي not seen commonly except for AIDS patients. جماعة الإيدز it is common. Adverse effects: GI distress, diarrhea, and pseudomembranous colitis. It is caused by Clostridium difficile treated by. طبعا هنا if you want to treat pseudomembranous colitis, as you can see here in this image, you see a sloughing or necrosis of the intestine because of the huge growth of Clostridium difficile, and thus you need to treat it with vancomycin or metronidazole تلاجيل. يعني كلورامفينيكول هذا دراج حاليا أصبح استخدامه محدود جدا جدا. It binds to 50S ribosomal subunit. It has bactericidal or bacteriostatic effect with broad spectrum covering gram-positive, negative, cocci, bacilli, including anaerobes, rickettsia, mycoplasma, and chlamydia. Even orally or IV, it has complete oral absorption. Excretion depends on conversion in liver to glucuronide and thus secretion in the kidney. لكن مع كل هذا الثيرابيوتكس يوزز مالته جدا محدودة. ليش؟ لأنه because of bone marrow toxicity يؤدي إلى serious bone marrow toxicity. ممكن يؤدي إلى bone marrow suppression or failure. Thus it may be life threatening. And thus بالنسبة للtherapeutic uses, the availability of alternative antibiotics and the emergence of resistance, chloramphenicol is no longer a drug of choice of any infection, except for serious infections due to few multi-drug resistant bacteria that remain susceptible to this antibiotic. أصبح استعماله جدا محدود إلا في حالات نادرة جدا لمن ماكو other choice. يكون عندك serious infection وواحد affected by multi-drug resistant bacteria بس بهالحالة ممكن نفكر به، ولا هو يعني تقريبا يعني استعماله أصبح نادر جدا. adverse effects as we said before ممكن يؤدي إلى anemia. ليش؟ لأنه يسوي bone marrow suppression. could be hemolytic anemia. It could be reversible. could be mild or could be aplastic. aplastic يعني يكون bone marrow failure. aplastic anemia يعني bone marrow failure يعني النخاع العظمي يتوقف عن إنتاج ال RBC وال YHBC وكذلك البليتلتس أيضا. This is the most serious type. بعد gray baby syndrome. شنو هذا gray baby syndrome? Because of the lack of necessary liver enzymes to metabolize this drug, chloramphenicol accumulates in the baby, causing hypotension, cyanosis, and often death. فلذلك يعني avoid using such drug in babies. Contraindication is contraindicated if another drug can be used instead. Simply, ما دام عندك other choice for antibiotic, alternative drug عندك, يصير chloramphenicol contraindicated. لأنه side effects مالته are very serious. نجي هسه على الفيوسيديك acid. This is a bacteriostatic antibiotic that's often used topically in creams and eye drops. يستعمل أكثر شيء استعمال موضعي. It may be given systemically as tablets or injections. Mechanism of action: it has a protein synthesis inhibitor by preventing turnover of elongation factor G, ما يسمى اختصار EFG, from the ribosome. It's effective for gram-positive bacteria such as Staphylococcus species, Streptococcus species, and Corynebacterium species. indications مالته for skin infections طبعا. most of the skin infections are caused by Staphylococci. But fusidic acid is a drug of choice in the form of cream or ointment. Eye infections, conjunctivitis, blood in the form of septicemia, bone infections, heart tissue and lungs, as in pneumonia or infections. Adverse effects: the eye drops may lead to stinging or burning for a short time after use and allergic reaction in the form of hypersensitivity. Cream may lead to rash or stinging، يعني واحد يحس في شيء يحرقه أو يشكشك. Fusidic acid suppression sorry suspension fusidic acid suspension إذا كان على شكل محلول ممكن يؤدي إلى stomach upsets. Contraindication here just in case of allergy. And thank you for your listening. And if you have any questions, you can ask on Google Classroom or send a private email. And don't forget to register your attendance in the attendance form. And thank you.